Dr. Van, I saw your email over the weekend and I have not seen anything either from that gentleman. So I'll reach back out today.
Well, you can give us, why don't you give the committee a report later on about what we did, so you'll know.
Okay, yeah, I think that's under executive session if I'm not
Right.
mistaken.
Yes, sir.
Okay,
And Jacinta, if you would be on the lookout for that other gentleman that requested the Zoom link and make sure we let him in.
Yeah, he's in the waiting room now. I'm gonna wait until we're streaming.
Perfect. Thank you.
You're welcome.
Who
Tracy, I just sent you the
requested
link.
who requested a Zoom link? Can we ask that?
David Miller,
Okay.
Willis Knighton,
Okay,
and we're going to keep him muted until he raises his hand to make a comment on whatever it is he wanted to comment on. So just when he comes up, just watch for his hand to be raised if it is.
and just for the committee, correct me if I'm wrong, Ms. Wilton. We will not engage in anything with Mr. Miller. He's only allowed to have a comment, correct?
That is correct. This is not a debate or discussion. We are receiving whatever public comment he wishes to make, and we thank him profusely for that, and we'll give it the due consideration that it requires.
Okay, we are now live.
All righty, I would like to call this meeting to order. Please note any comments by the public are welcome and can be emailed to publiccomment@lsbme.la.gov. Jacinta, please confirm you verify the identity of all tele and video conference participants. Is the sound clear and audible to the public and those on the tele and video conference?
Yes, sir.
Yes. All additions to the executive or public agenda must be made presently, as we will no longer make additions to the agenda after the close of the public session. I don't have anything to add. Does anybody else have anything they'd like to add to the agenda? Okay. Diana, would you do a roll call, please?
Yes, let me get unmuted. Okay, so Diana Mirandino, Raymond Peasany,
Present.
Mike Nolan,
Present.
Blake Nolan,
Present.
Brett Stafford,
Present.
James Lenahall,
Present.
Sheila Guidry,
Present.
Dr. Hugo.
Present.
Okay, those are our committee members, and then the LSBME staff. I have Dr. Van. I've got
Present.
Patricia Wilton,
Present.
Miss Bartholomew,
Present.
Miss Seduce,
Present.
and my Zoom host is that Jacinta?
Yes, ma'am.
Thank you.
You're welcome.
Did I miss anybody? I was
We
going.
have our high-tech guru, Tracy Morrow, is on.
Oh yes.
And we also have a Zoom guest, David Miller.
I've got both.
All righty, so we do have a quorum. So we'll go ahead and continue with business. Introduction. Finding that the agenda meets criteria under the Louisiana statute. Do we need to address that, Ms. Wilton, or has that been done already?
It's been done. Thank you.
Okay. We'll go back. Let's see. Public comments. Are there any public comments at this time?
No, sir, not on my screen.
Okay. We can move on to approval of the minutes from May 13th, 2024. Everyone should have received this in their packet that the board sent out.
I make a motion to accept the minutes.
I have a
Second.
motion by Michael Nolan. We have a second by Sheila Guidry. Is there any discussion? All in favor?
Aye.
Any opposed? Motion carries. Let's move on to old business. revisions to the RT rules and regs. As the board suggested, now that our committee is full, I think we can move forward with this, setting up monthly Zoom meetings as is, and please correct me if I'm wrong, Dr. Van or Ms. Wilton, other advisory committees that are revising their rules and regs or doing a Zoom meeting once a month to accomplish this goal. Is that correct?
That is correct.
Okay, so I guess, we've discussed this before. Is there, and I don't know if a doodle poll would be better, or that we can get when everybody feels whatever day during the month would be good to set aside, and what time of the day that would be good to set aside for a 90-minute work session.
Question, Raymond?
Yes, sir.
I'm sorry, I can't see that well, but on this committee is being formed. What exactly is it? Just the Practice Act, or what else?
Well, we needed to look at the Practice Act and the rules and regs.
Rules and regs. Okay.
So I guess, Jacinda, would there be a way of sending something out to the committee members, or to see like a doodle poll, so we can see when would fit everybody's schedule? What, and again, we don't have to have a quorum to work on this every time, correct, Dr. Van?
No, you do.
It's a meeting
sorry?
of the advisory committee, so you should have a quorum at least.
Okay. So, I guess, can we send out a doodle poll and so we can collect some data to see when would be good, would be a good date for everybody and a time frame? Is that something
can
the
do-
board can do for us?
Rather than a date, Mr. Pisani, it might be better to say, since we're going to do it every month, we'd say the first Monday of every month, the third Monday of every month, just as long as it doesn't interfere with our standing board meeting. If you want to make it the Wednesday morning, second Wednesday, I mean, those are the kind of things that would be better than saying pick exact dates. Because I think everybody knows the best dates and the best times of the week for them, and we can talk about the month. But I think rather than send exact dates, just say, do you like Wednesdays, Thursdays, or Fridays, and do you want the first, second, or third in every month?
And do you prefer mornings to afternoons, that kind of thing?
And if we do afternoons, we do have to complete by 5.
Correct.
Raymond, I have my hand up.
Okay, I can't see you. I apologize. Go ahead,
Oh.
Sheila.
Okay. I was going to say the exact same thing as Dr. Van. Try to set it on a certain day each month, like a Monday morning, on the third Monday of the month or whatever, rather than trying to get everybody to agree on different dates every month.
Are you offering a motion, Ms. Guidry?
Yes.
Okay, what is that motion?
A motion that we send out a doodle poll in reference to what day of the week and what week of the month would be best suitable for us to hold meetings to start working on the rules and regs and the Practice Act.
Do we have a second?
I'll second.
Blake Nolan second. Is there any discussion?
Only to add that as you already will, I'm sure, just indicate a preference for morning or afternoon.
All in favor? Aye.
Aye.
Any opposed? Okay, motion carries. Is this something that the board can do for us, Jacinda?
Yes, I'll send out an email. It looks like Monday is the dates that y'all have been having the meeting, so I'll start there. Monday morning.
Thank you, ma'am.
You're welcome.
All righty, we'll move on the agenda. Follow up on, respiratory therapy advisory committee members. We have, all our positions filled on our committee except for an LHA representative and one physician. And I know that Dr. Van has sent out and has spoke with boards and commissions, but, I don't know if they've had any applicants. Maybe with the new governor coming in, he may see if he can, appoint someone. All right, we'll move on to the RT app proposal from Willis Knighton. Has everybody had a chance to review the enclosed material that was submitted by Mr. David Miller? Is there would anybody like to open up discussion on this request?
I can.
Diana?
All right, so when you look at the orientation, the employee name, date, and the ID number, that I'm on the first page for WKHS new employee orientation. The employee has demonstrated proficiency by hands-on demonstration and knowledge of the following procedures. And so there it starts with oxygen therapy and moves into medication delivery. The question again that I have is that hands-on demonstration, is that actually on a patient, or is that done back in the department in a lab type fashion?
Jacinta, you can unmute Mr. Miller if he wants to respond.
Done, but I don't think.
David, you need to, his name is David. You need to unmute David.
Okay, I got it.
I did.
I think I had to unmute myself as well. I didn't understand that. Okay, got it. Excuse me, Diana, to answer your question, the hands-on demonstration is at a patient bedside under the direct supervision of either one of our RT department educators or a designated RT preceptor. It is not in a lab setting.
Okay, my next question to follow that. I'm taking notes, David, as I do this.
Okay.
So I'm just looking at the oxygen therapy. Okay. So once I have got the check mark from the conventional nasal cannula and the green high flow nasal cannula, prior to having an RT license, would I be assigned to go back out and do that again on a patient?
You would not be, the RT app would not be assigned to do that without direct supervision of
Okay.
a preceptor or RT department educator.
Okay.
And your qualifying point on that was before issuance of a license. So while they're still on orientation, before issuance of a license, no, they would not be allowed to do anything with a patient without direct supervision.
And David, I'm just going to clarify for you, because, when I started looking through this, just for the other committee members only, because I know your situation, and that is Willis Knighton has 4 separate institutions, so that when they orient an individual, they have to do 4 separate institutional orientation sites. You don't just get the one at the main campus and you don't see the other one. So I know it looks lengthy, and then you go, well, all of this is repeating, but he has 4 separate institutions that they're having to in-service employees. And my last question, and then I'll let somebody else. David, how long does it take for somebody to go through this process? And I realize it can vary depending on the particular person, but on average, how long does it take to make it through this?
Minimum 5 to 6 weeks.
Okay.
I'm sorry, say again, how long?
A minimum of 5 to 6 weeks.
5 to 6 weeks. Also, do the separate sites. Is it just the portion of a tour, or you have to repeat all 39 pages? Is it just the tour?
No, it's not just a tour. It's actual interaction with patients on each campus. And we do it, they don't necessarily repeat all 39 pages. They just have to make sure everything is checked off and they have demonstrated proficiency on at least one campus. And so because so much of our therapy exists on all 4 campuses, we give them that option. If you didn't see it on the North Campus, maybe you see it on the South Campus.
Is
I have
there
a
any other Okay, Sheila?
Okay, so David, at the end of the 5 or 6 weeks, if they have not passed their exam, then what happens to them? What do you do with them?
The plan would be for them to move to a different position in the health system, a non-licensed, non-credentialed position, say like some sort of an assistant, maybe an equipment tech, maybe a nursing assistant. And I'm modeling that after what our nursing service does already, with if they have an RN app who is in orientation and does not pass his or her boards and does not get a license issued, their employment is not terminated, but they were removed from their position as an RN app and put in a non-licensed, non-credentialed position. They can maintain their employment, they can maintain their benefits, they can prepare better for their next attempt at the board exam, but they're not allowed to do any care that would be nursing care, RN or LPN nursing care. And that would be the same plan for us.
Okay, yeah, I'm familiar with the nursing situation.
Right.
They've been doing that for a long time, but so you would allow them to do this, and then what happens if they take their 4th exam and they still don't pass? What do you do with them?
Well, they can either stay in that non-licensed and non-credentialed position, or they'll have to make some other choices for employment.
Okay. And the only other question I have is, so that you're using a preceptor for them at all these 4 facilities. You have that much personnel to be able
No,
to?
we don't, we stagger employment, because we don't have an unlimited resource, as far as RT preceptors or RT educators. We stagger them, and as we go on a calendar plan, as we anticipate one to be released, then we have another one waiting in the wings to join at that point.
But still staggering them, you have to supply that preceptor, which is taking that person away from patient care to precept this person.
That is correct. We have 4 RT educators. So that gives us 4 people that we do not depend on for daily RT staffing. And then we have our preceptors who are part of our staffing model. But when we know we have new employees onboarding, and we're going to have to use the preceptors paired with a brand new employee on orientation, we offer extra incentives to get people to pick up extra shifts, or we pull people out of our pulmonary diagnostics lab to do patient care to help supplement our staffing.
Hmm. Okay, that's all the questions
David?
I have.
David, I have a question.
Sure.
With your preceptors or your educators, it's however you define it, is this going to be a one-to-one education, orientation, or possibility they could have two with the educator, two staff members?
When they are at the bedside of a patient, it's one-to-one.
All right. Is there any other questions anybody would like to pose to Mr. Miller before we move on with discussion?
One last one. So I go and with my preceptor and I set up the handheld neb or deliver the handheld neb or whatever I'm being checked off on at that time. Once that is completed, how is that documented?
How is the proficiency or the competency of the test documented?
No, the care that was just delivered to the patient.
Oh, it's in our EMR. In our EMR. So the new employee, the one on orientation, has access to the EMR. And if the board approves this RT app plan, the new employee would document what they performed in the EMR. That electronic documentation requires a co-signature. The co-signature would be either by the RT department educator that witnessed or by the RT preceptor that witnessed.
So the entire time that I am doing this, I will never have the opportunity until you convert me to chart anything in an EMR without a co-signature on it from a direct observation piece.
That's correct.
Whoever that individual is.
That's correct.
Okay.
Is there any other questions for Mr. Miller? Thank you, David. We appreciate you answering our questions.
Sure thing.
Mr.
Dr.
Chair,
Collada?
well, I was
sorry,
just going to say, Mr. Chair, would you like to let him, I don't know if he has any remarks that he wanted to make other than what he was questioned on, but I would think you might want to offer him that opportunity if you like.
Thank you, ma'am. David, is there any further comments that you'd like to make to the committee?
No, I just really appreciate the opportunity to present the idea, and I thank you for your time to consider. I do believe if this is approved, that it will significantly help with our staffing crisis, and I'm sure that we are not alone in that situation. I'm sure there are so many other hospitals in the state of Louisiana that are in the same position we are. So I appreciate your time.
Thank you very much, David.
Thank you.
We have not received any other public comment through our public comment email.
That is correct, ma'am.
Okay, I have a question for Dr. Collada, please, and you, Ms. Wilton. Since we do not have a category of licensure or preceptorship with a graduate until they get licensed, can we move forward with this in some fashion, or would this have to be in the rules and regs some type of way, or in the law?
Pat, you want to go first?
I was going to defer to you, sir, but I believe that you could approve this plan. They do not end up with any authority to practice. They're in training. And so I believe that you could proceed with this as an approved educational path, training path within the rules. I don't know if Dr. Collada feels differently.
I feel exactly the same way. These are not licensed individuals. They cannot be doing anything independently. David seems to have outlined a process that does not allow them to do so. And so I think it really is more of a pre-employment orientation before they get finally employed as a respiratory care provider under the Licensing Act. So I
Thank
have
you.
no problem with it. I don't think we have a concern that you need to create a new class of license at all.
Okay. I appreciate your comments and your feedback on that. Is there any other discussion that any committee member would like to discuss before we move on voting on this?
I'd like to just make one comment. And again, David has done an outstanding job in lining this out. And having worked with Willis Knighton through the years with our clinics in respiratory therapy, I have no concerns about what he laid out. I want to make sure that if this goes through, and I do see it as an educational process and opportunity, and let's just say Hospital XYZ picks this up also, but doesn't do their due diligence, will this board somehow, if we get word of it, step in and step up to the plate? And I don't know how we do that with the cease and desist. And I'm not saying we shut this down because there'll be somebody that violates it. You write a law for the state, somebody's going to violate it. The question is, how do we go back? If it comes back to us that it's being violated, how do we step in and make them, desist? We used to see this with California College. These guys were supposed to be training in the hospital. Yeah, they showed them how to do a handheld, and then they put them to work. And it was called going to school. And that's not the way it was. And we finally got that shut down. So that's my only concern. Because I think David Miller has an excellent plan. I think it's going to work, and I think it will help the respiratory care profession. But I want to know how we're going to look at those that tend to violate.
Mr. Chair, if you don't mind, Ms. Sheila has her hand up if you want to take her comment first, or if she wants me to answer that question quickly.
No, go ahead and answer it.
Okay, I'm going to answer it with a non-answer, Ms. Diana, and the reason is that kind of delves us into legal issues and what our legal responsibilities are and our legal responses could be, and I'm going to respectfully decline to answer that in public comment, but I'm happy to address that in an executive session for legal advice.
There you go. I'm okay with that.
Thank you, Ms. Wilton. Sheila, I apologize again. I'm not getting everybody up on my screen.
No, that's okay. I was going to make the exact same comments as Diana. That's my concern. So many years on this committee, and, especially back when the California College situation that we dealt with and took so long to get rid of. And I have no doubt that David would do this properly. It's just everyone else that I'm concerned about, other places that would abuse it. And how we would be able to monitor this, but I'll wait for Ms. Wilton's answer in executive session.
Is there any other comments or discussion? How would the committee like to proceed with this request from Willis Knighton?
Is there a way that we can divert this to executive session, and then after we come out with some answers, then have a vote, or do we have to vote on it at this point in time?
Ms. Wilton?
You can wait and vote after you have any legal questions answered in executive session.
Do we need to vote on that, Ms. Wilton, or can we just table it until after executive session?
Yes, you can just temporarily return this to the agenda and you can vote on, you can make whatever motions or take action after you come back out of executive session. Unless you want to stop the proceedings now and go into executive session at this point just for this one item.
I'd like to wait till we go into executive session and after all the items have been discussed, please.
All right.
So we'll go ahead and table this until we come out of executive session when we enter. Okay. Is there any other old business anybody would like to discuss? Is there any public comment at this time?
None that I have received, sir.
All right, we'll move on to new business. Introduction of our new committee members. Ms. Wilton has sworn in our two newest members, Mr. Blake Nolan. Blake, I think you're out of the Monroe area, if I'm not mistaken.
That's correct.
And our public member, Mr. James Lonahan, he's out of the False River areas, I believe.
Correct.
Thank you, sir. We appreciate y'all coming on the committee with us. I look forward to continue working with y'all. Licensing supervisors report, Phyllis Johnson.
Good morning. Yeah, I have no report. Nothing.
Thank you.
All right.
Priscilla Bartholomew, licensing analyst.
We have nothing at this time.
Thank you, ma'am.
You're welcome.
All right, we'll move on to Dr. Vincent Collada, our executive director. Dr. Collada.
As many of you know, and you new people are finding out today, I have been appointed to the national committee that has been working up the proposal for the bylaws and operational guidelines for the compact respiratory therapy system. It is moving along faster than most of us felt it would. I mean, the biggest sticking point is that some states are still having problems with the criminal background check. Those of us that have it in our law will not have a problem, which is like Louisiana, but some states have never done background checks. And so everybody is trying to iron it out. The compact forming group, which is a corporation out of, a good government corporation out of Tennessee, Kentucky, is working with the FBI, and they have a new draft of a bill that they're trying to pass through Congress to make this easy for everybody. But we in Louisiana will not have a problem with it. I still think it's about 24 months away, but again, at this point in time, I think the key here is to make sure that we get this right, and it seems like it's going well at this time. So far, the participants have all been very involved and are working hard. Several of them are licensing directors, much like myself, or licensing agencies like myself and the LSBME. Some of them are the people that run the respiratory therapy certification agencies. So we have a lot of good input, and I think it's moving along very well, but I'd be surprised if it's operational before 24 months. And of course, somewhere along the line, we're going to have to find somebody as a legislator to introduce the compact law into Louisiana for this to occur. I think it's a little premature now, but as we get closer to the next session, we can talk about this. We're going to be meeting monthly, and I'll keep you all appraised of this.
Thank you for your support, and thank you for your support, Dr. Van, and to continue to work with them to move legislation for, to move this process forward for us. Okay. Did you want to speak about temporary permits, Dr. Collada?
Well, I really, I want to tell you that I'm very, after talking to the people who give the certifying test, the test is so oftenly available, frequently available. I think we can talk about, temporary permits to be the exception rather than the rule. I think we can process faster and get the licenses together quicker and get the credentials approved faster if we get simply not fool with, we don't have to go to the schools. We don't have to go to get the transcripts because all of that is being done by the certifying agency. So we can eliminate several steps if we just simply say, you don't get a license until you pass your certifying exam. And then you would have nobody practicing in a situation where they had not passed the test. And then if you really have an exceptional problem, we can talk about it. But I think rather than make it the routine, if you haven't passed the test to get a temporary permit, just say no temporary permits, and everybody gets their certification, and then we can license everybody much quicker. So I would hope you would support us doing that, because our job is to get them licensed as fast as possible. When we take time to start doing other things to get a temporary permit, then we still got to license them. So it makes a lot of extra work for us that really is not sufficiently, I think, worthwhile to make sure we get good quality people working in our state.
All right, we'll go ahead and open it up for discussion, and I'd like to go first on this, please. It's my understanding, Dr. Collada, that you have been working closely through the compact licensure meeting, the NBRC representative, I think especially Ms. Lori Tinkler, who is the executive director for the NBRC. And I think y'all recognize, as you said, that we could eliminate a few steps along the way and get these licenses approved a lot faster. So I think this is a very positive, proactive move, in my opinion.
Thank you, Raymond.
Any other discussion from any committee member?
I was just going to say, I don't have a problem with it. If, again, we're looking at it, it should be a very, very, very rare exceptional process. And I don't know what that exception is. And that would be for the LSBME to decide. I would just hate to see the language go away. And that may, and I don't know how, maybe that's something that can be addressed in when we look at rules and regulations. But I agree. I don't see the point of a temporary just to allow me to go out and pass my board exams, because each of these programs should be training to get them to pass it on the first, if not second attempt. And each of these students, I'm hoping with other programs, because the programs have a vested interest, because when they don't pass, it doesn't make the program look good for accreditation, that those that don't pass are getting back with their programs for assistance. And I know we have an open door policy up here, so I don't have any problem with it.
Is there any other discussion?
To assure Miss Diana, we are not going to take the language out. The current language in the law and the rules is permissive, but not mandatory. And so from an internal policy procedure, we will keep that permissive. And quite frankly, I think we all learned a lot about what happened during COVID, and we may have to make those kind of things happen during COVID. We kind of reserved those situations. Testing was not as frequent and all of those things, but according to Ms. Laurie at the commission, it is doing, testing is fully funded. It's moving along great. And I think the key is, she tells me that very few states are issuing temporary permits anymore. And I think it would be the exception rather than the rule in a unique situation if we found ourselves in a Katrina or look, those of us who've been around long enough know how bad it can get. And I always want to keep it a loophole for us to utilize it. But as a routine process, I want to get my licensing analysts to get those things done as fast as possible, because it really serves the community that you represent the best. So Ms. Diana, I hope that answers your concern.
No, it does. And I am all, we never know what that next emergency might be, such as I don't know about y'all, Dr. Van, but we had the IT issue 2 weeks ago.
We dodged that bullet thanks to my IT team not going to that company. We I had to give my guys an attaboy for saying no, let's not do that.
So I have a
We
question.
didn't, but we were back up and running, I would say, within 12 hours. So it was okay. It could have been worse.
Mhm.
Sheila, did you have your hand up?
Yeah, I just want to clarify. I'm in favor of doing this. That would have nothing, it would not affect the four-strike rule, correct?
No, ma'am, it would not affect the four-strike rule.
Okay.
Does anybody else have any discussion or comments? All right, so I'll entertain a motion that we move to issuing licenses once the applicants have, and correct me, Ms. Wilton or Dr. Avan, after they pass their NBRC exam.
That is correct. And it would save us some steps. So we would not issue a license unless we have NBRC, and then that eliminates the step of going to try and track down a transcript from the school, checking the school's approval. It's all, that's done by NBRC, so we don't have to do it. Just keeps us from redundancy and work.
Okay, do we have a second on the floor?
Second.
Second, Diana. Is there any discussion? All in favor? Aye.
Aye.
Any opposed? Okay, the motion carries.
Thank you very much.
Thank you. Is there anything else, Dr. Collada, that you'd like to discuss with the committee?
No, I think the next discussion we'll have would be an executive session, so
Okay.
I'll let you.
Is there any other new business anybody would like to discuss? Is there any public comment at this time?
There's been no email public comment at this time.
All right. At this time, I'd like someone to offer a motion to move into executive session.
I move.
Sheila,
Second.
second, Brett. All in favor?
Aye.
Aye. Any
Aye.
opposed? All right, Jacinda, if you can move us all into executive
Thank you,
session,
Mr. David, for your comments today, and we'll be excluding you from the rest of the meeting, sir.
That'll be fine. Thank you so much.
Thank you, David.
Thank you.
Okay, give me a sec.
Jacinda, let me know when everybody's back in the room.
Okay, looks like we're waiting on Sheila.
She might not know that she had to exit. You moved us last time without a exit.
Yeah, she'll come out. It'll just take her longer if she doesn't press the button.
We're not in executive session yet, huh? I mean,
Correct.
in regular session.
No, we are in public session.
Okay. Are we streaming?
Yeah.
Mm-hmm. We are.
There she is. You're good, Raymond.
All righty. I'd like to move back to our tabled item under old business, the RT app proposal by Willis Knighton. Diana, can you read us that motion?
I would, yeah, we need to entertain a motion that the Respiratory Care Advisory Committee recommends that the LSBME render a advisory opinion on supporting David Miller's request and RT with the RT app.
Do I have a second?
I'll second.
I have a second from Blake. Any discussion? No, we don't do discussion. All in favor? Aye. Is there anyone
Aye.
that opposes? Anyone opposes? All right, the motion carries. Item 6, next meeting date. I would like to change that meeting date to December the 2nd. Do I have a second on the floor?
Would you, I'm a little confused. Don't you want to start setting up monthly meetings?
She's gonna send out a doodle request to see what
So you're gonna want to
time.
have you want to have a meeting in September and October and November anyway.
No, you're talking about, well, either way, he wants to replace the November meeting. He doesn't want to
Right.
have it on the current date of November 18th.
But again, once you all pick a date, we like the first Wednesday, second Wednesday of every month. We can move the November meeting to the second Wednesday of every month, unless you want to move it to December. But then they may have a December 2nd meeting, and then later on in the month you have another meeting to work on your rules.
I think that might be what the chair is envisioning, that we have a 90-minute session to just work on the rules and then have our regular meetings as currently scheduled.
That's fine with me. I misunderstood him completely.
I apologize, Doctor. So do I have a second on the floor to change the next board meeting, committee meeting? Michael seconds. Any discussion? All in favor? Aye.
Uh,
Aye.
All right, is there any other business anybody would like to discuss? All right, do I have a motion to adjourn?
Motion
Make a
to
motion.
adjourn.
Second.
Second by Jim. All in favor?
Aye.
Aye.
Dr. Van, I have a question for you after we exit
Sure.
public streaming. Thank y'all for your time.
Thank you, Raymond. I'm leaving. I got a 10:30 meeting.
That's fine. Just let me know when we're not streaming anymore.
Okay, give me a second.
Y'all have a great week.